This conference will now be recorded.
Good morning, everyone. Am I audible?
Yes, sir.
Okay. Thank you. So, what are the topics we have covered so far? Can anyone remember? Do you see any display of embryology?
Yes, sir.
Okay, then. So far, regarding anatomy and other topics have been already discussed previously. I'm just making a quick revision of the previous topics only. So, they have informed you regarding the exams, right? Hello? Hello?
Yes, sir.
So, how is your preparation? Hello? So, we were making a revision of the class only. So my topic is regarding only oral cavity and oropharynx and all. We have discussed regarding the tonsils, adenoids, anatomy of the oral cavity, tongue, carcinomatas, tumors, and adenoids. Coming back to basics again, today we will discuss some topics of anatomy and all. So if at all any topic has not yet been covered, you can kindly make a message to your CR so that I will repeat the same topic, or I will explain anything whichever it is missed in the next classes. Is it okay for you? Hello?
Yes, sir.
Some of you please respond so that I think you are actively listening to the class.
Yes, sir.
What is the topic going on in regarding ear for you? Hello? So no one is actively listening to the classes. So I will ask you, I will point out some of you. Roll number 108 is present.
Yes, sir.
Okay, what's your name? Farahata.
Farhad, sir. Yes, sir.
So what is the topic going on regarding ear? What was the last class taught to you?
Diseases of external ears, sir.
Good. Apart that, Satish sir taught you which class?
Chronic suppurative otitis media.
The previous class was? Previous ENT class. From next week, I think you will have only 4 classes in a week. In total. Your schedule is changing. So you discuss among yourself and you can ask me any topic if you want. I will teach you in the next class. regarding this oral cavity and oropharynx. Today I am repeating some of the old topics which have been covered by other lectures as well as mine. Today we will discuss only anatomy of the pharynx. This is just an image
Okay,
of the
sir.
embryology.
Fracture of the face was completed, sir.
Fracture of the facial bones, nose and maxilla, those things have been completed now. Not complete, I think have started that
Yes,
part.
sir. Started, sir.
Okay. Today I will finish the class in short regarding embryology, whether in not only in the first year, in the final year, when it comes to general surgery or even ENT, when it comes to pre-PG exams, you should be well aware of the embryology of the human body, from which among which the important one is pharyngeal or brachial arches. Okay, so the foregut is formed by the endoderm, which will result in formation of the aerodigestive tract, which means both the lungs, pulmonary system as well as the digestive system is formed from the endoderm, which is margin. This is nothing but the outpouching of the endoderm, which will form the various organs of the body, such as esophagus, stomach, duodenum, and etc. So coming to ENT, development of the neck, that is formation of the pharynx. This is very much important for you. Today my topic is confined to only pharynx. So the branchial arches develop at the 4th week of the embryonic period, which contribute formation of the neck as well as face, which will be visible at the time of 5th weeks. So where do they derive from? They derive from the neural crest cells, which resemble the fish gills coming to development or in form of evolution. They begin at the early of the 4th week. By the end of the 4th week, 4 pairs of arches are visible on the surface, and a buccopharyngeal membrane which ruptures, forming a communication between the primitive oral cavity and foregut. These are the pouches formed on the lateral side, which can be visualized. So why are they so much significant coming to embryology? Because each arch is having their own separate form of mesodermal or neural origins, such that the blood supply, nerve supply of those muscles or bones which originate from that part of the arch are restricted through those nerves and blood vessels only, based on which the abnormalities, the congenital conditions can be evaluated. So core of the mesenchymal tissue is covered by surface of the ectoderm by the outside and by the endoderm by the inside. The ectodermal forms the skeletal parts, thus the mesoderm forms the muscle with the accompanying nerve. The arterial component is at the aortic arch. Therefore, each arch carries a nerve, a muscle, a bone, and blood supply. Coming to pouch, these are nothing but the endodermal origin, where outward growing of the endoderm, which form the pouches, among which the first pouch is tubotympanic recess, which means tube is nothing but the eustachian tube and tympanic is the tympanic membrane formation at the middle ear, and eustachian tube is formed by the first pharyngeal pouch. And the second is palatine tonsil or palatine fossa. If any maldevelopment of this part will be forming a terminal end at the level of palatine tonsil. And the third is the infraparathyroid and the thymus, whereas fourth is the superior parathyroid. These two are not that much significant. Whereas the fifth is the ultimobranchial body, that is calcitonin producing C cells of the parafollicular cells. Among this, the second is also very important. So the congenital malformations, formation of the branchial pouches, this one is important. The clefts are from the outside, that is from the ectodermal. First is the external artery meatus, and second and fourth from the epicardial ridges and the cervical sinuses. So here you can see the number of clefts are almost similar, but the thing is the second things overlap such that it will masks the formation of the other clefts so that it appears as a smooth continuing on the outside. Any incomplete closure of these clefts will result in formation of the branchial sinuses, similar to preauricular sinus in the pinna. This is important for you at the BITS pre-PG level or at the general surgery also. In the final year also, all these things are important. So each color denotes the each branchial arch from which various organs are developed. So here you can see the metals cartilage that is in the first one, where the incus, malleus, and the mandible are formed. Whereas the second one is S is the simple code word S, all which starts with S, that is stapes, styloid process, styloid ligament. And the other things include lower part of the hyoid bone, that is the lesser horn and the greater horn of the hyoid bone. And the other fourth is from the thyroid cartilage, that is superior part, whereas inferior cricoid is found by the sixth one. Okay, the various derivatives of arches. I think you must be aware of this one since from the first year of the MBBS. Same as we discussed earlier, whereas the cartilaginous forces from the first arch. These are the muscles which are involved. If you observe closely, these muscles all are supplied by the single nerve, whereas these muscles are in connection to the bones related to the origin of the first arch, that is incus, malleus, premaxilla, maxilla, zygomatic part of the temporal bone. And these muscles will be in contact with these bones only. Here you can see muscles of the mastication, anterior belly of the digastric muscle, mylohyoid, tensor tympani, and tensor palatine, which are surrounded by the fifth cranial nerve, that is trigeminal nerve. Coming to the second, which forms the stapes, styloid process of the temporal bone, stylohyoid ligament, lesser horn of hyoid, upper part of the body of the hyoid, which are connected by stapes is connected by stapes muscle. Styloid process with the stylohyoid muscle, whereas posterior below the digastric, auricular muscle, and the muscles of the facial expression. All the muscles of the facial expression are connected through facial nerve. Lower part of the body of the hyoid and the greater corner of the hyoid are connected by ninth nerve, that is glossopharyngeal nerve, whereas the muscles involved are stylopharynges. This function is at the level of deglutition. This function is at the level of mastication. Again, at the level of formation of thyroid cartilage, cricoid, arytenoids are all found by the fourth branchial arch, that is cricothyroid, levator palatine, and constrictor muscles of the pharynx. These will also indirectly help in deglutition, whereby elevating or lifting the thyroid cartilage, which will create a negative pressure behind the thyroid, that is at the hypopharyngeal level, thereby shifting the food bolus into the esophagus. Similarly, cuneiform is found by the recurrent laryngeal. All intrinsic muscles of the larynx are supplied by recurrent laryngeal nerve. So whenever a small child presents with a small discharging pus point at the neck, if you examine closely, if it is present anterior to the sternocleidomastoid muscle, remember, if it is present anterior to the margin of the sternocleidomastoid muscle, then you should suspect a branchial cyst or branchial fistula. You should ask the parents whether there is a consanguineous history. Similarly, you should check for other sinus organs like preauricular sinus, where the first pharyngeal cleft is involved. So what happens in this? There is an incomplete closure of the branchial arch, overlapping of the branchial cleft. So how do you trace out in these patients? So if we see a cyst or a fistula, then we will reduce the infection with antibiotics. Later in the surgery, you will give methylene blue solution, which will trace out or which will give the tract of the formation of the sinus, which will be where the superior limit of this tract is will be usually at the level of palatine fossa, depending on the which arch it is involved. So coming to the anatomy of the pharynx, I think that this topic is also been covered previously while explaining the esophagus or nasopharynx also. So the pharynx involves from the limits are superior limit is base of the skull to the inferior border of the cricoid cartilage anteriorly and inferior border of the sixth cervical rib at the sixth cervical bone at the posteriorly. Widest portion is at the level of hyoid and the narrowest is at the caudal end, it is 1.5 centimeter. Divides into nasopharynx, oropharynx and hypopharynx or laryngopharynx. Nasopharynx, as discussed previously, it plays an important role for respiration, air pathway, as well as phonation. The phonation is due to the resonance of the sound traveling from the nasopharynx into the on either side of the maxillary and other paranasal sinuses. They will act as a resonators. Anterocoena, posterior posteriorly pharyngobasilar membrane and the superior constrictor muscles involve the posterior border. Anterior lies the coena, superior lies the basis spinatus and basilar portion of the occipital bone, and inferior at the level of soft palate. So this is an image where you are viewing the entire pharynx from the behind, which is cut sectioned open on the midline and the posterior. So this will be the image if you see in a circular image of this part will be the seen in case of any indirect laryngoscopy, certain as an nasopharyngeal examination. These are the turbinates, posterior ends of the turbinates. This is the septum, posterior end of the septum. This is the eustachian tubal opening, whereas the bulge. This is the soft palate. This is the uvula. This is the superior margin of the epiglottis, which will form the. From here there is a laryngeal inlet with the arytenoids on either side. If you observe closely, this is the posterior cricoid area. That is the posterior part of the laryngeal part. This will be the lateral pharyngeal wall. So this will form a inverted triangular pyramidal shape of the fossa, which is nothing but the pyriform fossa, which is also a hidden area from which the food is diverted. So this is the base of the tongue actually. Between the epiglottis and the base of the tongue, there is a small traphe which will divert the food particles on either side into the pyriform fossa, from which they will reach into the cricoesophageal junction and into the esophagus. This is the posterior part, posterior from the posterior. And this is a sagittal section in which you are seeing this is the base of the tongue, that is the posterior part of the tongue. This will be the hard palate and this will be the soft palate ending into the uvula. Here you can see the various concha, that is various tablets ending. This is the posterior margin, or that is the posterior coena, behind which you can see the esophagus as well as bulging of the torus tubalis, that is the eustachian tube opening. Here you can see anterior and posterior arches of the tonsil and where the tonsillar bed contains the tonsil. As you go behind in the valvular region, and this is the epiglottis. The same linear diagram. Again, this is the sphenoid sinus. These are the turbinates, superior and inferior turbinate. This hard band is the hard palate, and this is the soft palate. This continuing at the mid portion to uvula. This is the tongue. This is the base of the tongue. This will be the anterior pillar with the tonsil. This is the posterior lining of the pharynx, and here you can see the eustachian tubule opening. This is the site of formation of the tumor such as angiofibroma. You can see this one as the adenoids. Behind the just below the level of sphenoid or rostrum of the sphenoid, here you should notice any bulging for formation of adenoids. If the soft tissue of adenoids reach from here to near to the level of soft palate, if it is obscuring this area of the nasopharynx, then there is a severe grade of or higher grade of adenoid formation. The same image, if you draw this image, this will be sufficient at the exam. Same eustachian tube opening, hard and soft palate uvula, adenoids formation, Vasquez pouch. That is embryological origins. This is the sphenoid and base of the skull. This is an image of the nasopharynx. To be more specific, nasopharyngeal examination. Coming to oropharynx, this topic has already been while discussing about the tongue or oral cavity and other tumors. Everyone knows the function is digestive, that is mastication and formation of the food bolus, thereby propulsing the food into oral cavity. Anteriorly lies the anterior tonsillar pillar, posteriorly lies the superior constrictor, superior lies the soft palate, that is the inferior margin of the nasopharynx, inferior left the valvula, laterally by the palatoglossal and palatopharyngeal arches. We all are well aware of these parts, that is uvula, palatopharyngeal arches, palatine tonsil, palatoglossal arch. The other names of the anterior and posterior to be more specific. From the palate to the tongue, that is anterior tonsillar pillar. From the palate to the pharynx, that is the posterior tonsillar pillar. That's it. This one we have already discussed in the previous image only. It's a repeat image. Coming to hypopharynx. This lies posterior to the larynx and superiorly the superior border of the epiglottis and the pharyngoepiglottic folds. Inferiorly up to the level of cricoid. That is inferior border of the cricoid bone, and posterior or posterolaterally by the middle and inferior constrictor muscles. So when it comes to constrictor muscles, superior constrictor muscle comes under oropharynx, whereas middle and inferior constrictor muscles come under hypopharynx. Importance of this one is formation of the Killian's dehiscence. That is the importance. Anterior the laryngeal inlet. Same. This is the area of the hypopharynx. From the laryngeal inlet onwards. The subsites are, so these are, what do you mean by subsite? It is where the chances of formation of carcinoma is more, and usually it is a hidden area which are usually unnoticed by the physician. That is at the level of pharyngoesophageal junctions, pyriform fossa, posterior pharyngeal wall. That's at the level of cricoid. Same as we discussed earlier. This is image taken from the Dingara. Excuse me. So embryologically there are 4 layers. Mucous membrane, as we see. Next comes the pharyngeo-basilar fascia, followed by muscle layer and buccopharyngeal fascia. That is, the muscle layer is between these two fascias. On the near the buccal side is the buccopharyngeal, and towards the pharynx is the pharyngeo-basilar fascia. Importance is formation of abscess. Retropharyngeal abscesses are formed when there is an impacted foreign body in this region. The mucous membrane is pseudo-stratified columnar ciliated epithelium in the nasopharynx, whereas non-keratinizing stratified squamous epithelium in the oropharynx and hypopharynx. The cilia is due to diversion or clearance of the mucous particles from the nasopharynx, similar to trachea also. The nasal, that's why it is the main demarcation of nasopharynx, oropharynx is based on this epithelium only. Respiratory epithelium in the nasopharynx contains goblet cells in the, it is pierced by the ducts formed by the glands that is deep to the submucosa. It has a large amount of subepithelial or gut-associated lymphatic tissue, which forms the walled air limb. Called this comes under GAT, where it is forms a major part in immune system. This is an image from the Dingara. You should draw this image, which will be sufficient for your examination. Discussed earlier also. We have discussed regarding the constrictor muscles also. That is superior, middle, and inferior. They help in diversion and deglutition is the major role. So coming to superior constrictor, raise and above downward of the posterior border of the lower part of the medial pterygoid plate, pterygoid hamulus, pterygomandibular raphe, and posterior end of the mylohyoid line, and by few fibers from the side of the tongue. It attaches posterior to the median raphe and by an aponeurosis to pharyngeal tubercle on the base of the skull. Band of muscle fibers arise from the anterior and lateral part of the upper surface of the palatine aponeurosis. Arise from the anterior and lateral part of the upper surface of the palatine aponeurosis and sweeps back towards the levator palatine to blend with the inferior surface of the superior constrictor. This is called as Purcell's ridge. Purcell's ridge is important because it is the line at which the soft palate gets in contact with the posterior pharyngeal wall. Middle constrictor posterior edge of the lower part of the styloid hyoid ligament and lesser corner of the hyoid, whole of the upper border of the greater horn. Upper fibers ascend and overlap superior constrictor and inferior fibers are deep to the inferior constrictor. Coming to inferior constrictor, two parts are thyropharyngeus and cricopharyngeus. If you remember well, the anatomy of the inferior constrictor is much more important because the alignment of the muscles are different. That is, one is horizontal, one is angular. Thereby, there is a triangular gap between the thyropharyngeus and cricopharyngeus. And this is the site of formation of the juncus diverticulum, which is an important question in terms of ENT or as well as in general surgery also. Longitudinal muscles. Stylopharyngeus styloid process passes between the superior and middle constrictor, and some fibers merge with the constrictors and lateral glossoepiglottic fold. Other fibers insert into the posterior border of the thyroid cartilage, supplied by glossopharyngeal nerve. Similarly, palatopharyngeus and salpingopharyngeus muscles. The structures of soft palate, which is much deeper, can't be explained right now. So structures which enter in the pharynx. Above is the superior constrictor, which contains cartilaginous part of the stretching tube, tensor palatini, levator palati, palatin branch of the ascending pharyngeal artery. The superior and middle constrictor lies the stylopharyngeus glossopharyngeal nerve. Between middle and inferior constrictor, internal laryngeal nerve and superior laryngeal vessels are present. And below the inferior constrictor, recurrent laryngeal nerve and inferior laryngeal artery are present. Coming to blood supply, the entire blood supply is from the external carotid artery and its branches. As you remember, whatever may be the vascularity in the neck, it is separated from the external carotid artery only. Whereas internal carotid artery has no branches and it reaches directly at the level of brain. So ascending pharyngeal artery is the branch of external carotid artery. Next is ascending palatine and tonsillar artery, which are branches of facial artery. Greater palatine artery and pterygoid artery, which are branches of maxillary artery. Dorsal lingual artery, branch of lingual artery, which form the blood supply, whereas veins are arranged in internal submucous and external pharyngeal plexus. This drains into internal jugular vein and anterofacial vein. Coming to pharyngeal lymphatic drainage, hypopharynx deep 2, 3, and 4 levels, whereas nasopharynx in 2, 5, and 3. Coming to retropharyngeal space between the prevertebral and buccopharyngeal fascia is present, and the retropharyngeal lymph nodes are present, which opens into the superior mediastinum and spread of infection in the tumor is present. Here you can see the retropharyngeal space just behind the level of posterior pharyngeal wall. This is the cervical fifth vertebrae, whereas here you should notice the largest muscle is nothing but the sternocleidomastoid muscle, behind which lies the internal carotid artery and internal jugular vein. So the vein is in a oval shape because it is collapsed due to, it is oval due to the pressure exerted by the muscles. Here you will see 9th and 10th cranial nerves. These are nothing but the strap muscles anteriorly, styloid, thyroid muscles. Parapharyngeal space is also an important topic for you when it comes to exam. This inverted pyramid is most often space involved, and the base of the skull to, it extends from the base of skull to superior mediastinum. Contains loose alveolar tissue and fat. Communicating with the submandibular, retropharyngeal, superior mediastinal, and carotid sheath. This is the image of the parapharyngeal space. So I think this deep neck spaces topic has already been discussed. We'll skip this part. Anatomy of the esophagus will not be taught you right now. So we have just briefly discussed again anatomy of the pharynx. Mainly today I'm intended to focus only at the level of pharynx. So I think any doubts? Hello? Hello? Okay, everyone has kept their IDs under mute, I think so. Number 110. Roll number 110. Absent. 132. 132 is also absent. Roll number 11. Number 130. Roll number 130, Harini.
Sir.
Present. Friends అందరూ ఏమైపోయారు? 136 మంది. I think there is no use at all for you, right? 1 second. 110, roll number 110. This image is not clear for you. Harini.
Sir.
అందరూ ఏమైపోయారు? ఫ్రెండ్స్ అందరూ ఇమేజ్ కనిపిస్తుంది హరిణి?
కనిపిస్తుంది సార్.
సార్ 110 ప్రెజెంట్ సార్.
ఏం చేస్తున్నా ఇప్పటిదాకా?
సార్ మైక్ ఆన్ అవ్వట్లేదు సార్.
నీదా?
ఎస్ సార్. ఇప్పుడు రీస్టార్ట్ చేశాను సార్, మళ్ళీ ఆన్ అవుతుంది.
110 పేరేంటి?
రేవంత్ సార్.
Tell me Revanth, what is this one? You can see the arrow mark kada?
ఎస్ సార్.
What is this blue island? Revanth?
సార్
110 Revanth. చెప్పిదేంటి? నీ బెస్ట్ ఫ్రెండ్ ఎవరు?
132 present, sir.
132 Tejaswini.
Yes, sir.
Can you tell me what I have pointed here?
Pharynx sinus.
Sphenoid sinus.
Number 110 ఎవరు మెసేజ్ ఇచ్చారు నీకు? సరే 132 తేజస్వినియా?
Yes, sir.
Hello?
Yes, sir.
Can you tell
132
me what is present here?
pituitary
Can you
gland.
tell me what is here? What will be here? Very good.
Pituitary gland.
Number 110. Okay, thank you. Number 110.
Sir.
What is this C here? ఇంకెవరు రిప్లై ఇవ్వలేదు నీకు ఫ్రెండ్స్? రేవంత్, what is here? What is this one? C. Number 67. Number 67 present or absent? Number 99. మీ ఫ్రెండ్ 69 సూర్య ఉన్నాడా? రేవంత్? సూర్య కేమ్ బ్యాక్. చెప్పు రేవంత్, సి ఏంటి ఇందులో?
Sphenoethmoidal disease.
అంత పెద్ద పెద్ద పదాలు మనకు అనవసరం, ఎక్కువ చెప్పేస్తున్నాం. 69 సూర్య.
Yes, sir.
Come Surya. What is this one? C here, labeled as C.
Adenoids, sir.
Very good, Surya. Very good. What is this A?
Inferior turbinates.
Good, good. What is this J?
Palatopharyngeal fold.
Palatopharyngeal fold. Came near. Good. ఎక్కడ ఉన్నావు సూర్య?
సార్ ఇంట్లోనే ఉన్నాను.
ఓకే ఓకే, సౌండ్ ఎక్కువ వస్తుంది. గుడ్. మీ ఫ్రెండ్ రేవంత్ ఏడి? రేవంత్, ఇది స్పీనో ఏమన్నావు? స్పీనో ఇథ్మైటల్ డిసీజ్ అన్నావా?
Yes, sir.
కాదు కదా, మరి ఏంటది? మీ ఫ్రెండ్ చెప్పాడు కదా సూర్య, ఏంటిది?
Adenoid.
గుడ్ గుడ్, ఎడ్నాయిడ్. సో ఈ ఎల్లో బల్జింగ్ ఇది ఎడ్నాయిడ్ అయితే ఇదేమవుతుంది చెప్పు? కే. రేవంత్?
Tonsil, sir.
వెరీ గుడ్ రేవంత్. నువ్వు ఆన్లైన్ లో ఉండాలి, మీ ఫ్రెండ్స్ ఎవరో నీ మెసేజ్ చేస్తారు ఇప్పుడు, ఆన్సర్ ఇది ఆన్సర్ అది అని. ఓకేనా?
Online లోనే ఉన్నా, sir.
ఓకే. మరి ఇది జే?
Palatine tonsil.
ఇది టాన్సిల్. యూ హ్యావ్ ఎక్స్ప్లెయిన్డ్ కేఎస్ టాన్సిల్. వెరీ గుడ్. సో దిస్ ఇస్ ఆరిజినేటింగ్ ఫ్రమ్ ది palate, ending to the tongue. It is glossal, palatoglossal fold, anterior tonsillar pillar. Okay,
Yes,
anterior to the tonsil, no? Anterior tonsillar pillar. రేవంత్, నీ బెస్ట్ ఫ్రెండ్ పేరు చెప్పాలి నాకు అర్జెంట్. సూర్య
Yes, sir.
అండ్ రేవంత్ బెస్ట్ ఫ్రెండ్ ఎవరు? సూర్య చెప్పు సూర్య.
Sir.
కిషోర్ ఎవరు? నెంబర్ 20 కిషోర్. హలో రేవంత్, అన్ని నువ్వే ఆన్సర్ చేస్తావా? మీ ఫ్రెండ్ చెప్పవా పేరు? ఒక్కడు కూడా లేడు నీ ఫ్రెండ్.
Surya, sir.
రేవంత్ ఫ్రెండ్ సూర్య. అలా ఎలా అవుతారు నేను రాండమ్ పిలిచిన వాళ్ళందరూ? నీ నెక్స్ట్ నెంబర్ ఎవరు రేవంత్?
Anjan, sir.
111 111 ఎవరు?
Present, sir.
What is G here? Can you tell me what is G? So I am giving a hint that this yellow color irregular bulging part is nothing but a aggregation of lymphoid tissue. So what could be G? Or else tell me what is F?
Tubal tonsil, sir. G.
Yes, good, very good. Seventh ముందు number 109 109 ఎవరు? Hello, 109 present or absent? Not responding. Okay then. 142. Roll number 142. Present or absent? Hello. Lera. 1 second. ధనుంజయ్ 89 ధనుంజయ్ ఎవరు? హలో, 133 నీలిమ.
Yes, sir.
Good morning నీలిమ.
Good morning, sir.
So can you tell me what is L here? Is it visible for you, the small image?
Yes, sir.
Can you name what is L?
Sublingual tonsil.
Lingual tonsil is enough. Okay, good.
Yes, sir.
Very good. Not sublingual. What is this? What is this F?
Eustachian tube, sir.
Eustachian tubal opening. Good. So this will be the. Can you please repeat all of this one? What is C?
Lymphoid aggregation.
Of adenoid tissue.
Adenoid tissue.
G. This is Eustachian tube. Then what will be this one? Peritubal tonsils. The tubal opening. And what is K? K will be
Palatine tonsil.
good, palatine tonsil. And this is the lingual tonsils.
Lingual tonsil.
These will form what ring?
Varley's ring.
Okay, very good. Thank you. Which class do you want? Which topic do you want to tell me in the next class? Nirma? Or else is there any topic which is left over? Nilima,
Sir.
just check out any topic which is left over. Ask your friends so that I will tell you in the next class. In the next
Okay,
week, I will
sir.
take every Saturday. I will take the class for you.
Okay, sir.
Okay. Please
Okay, sir.
do read. I think you are enjoying. Not for you, not for Nilima. This is for everyone. Right. Hope you are having a plenty of free time at home. And I know that your parents will be most irritable in this scenario. Colleges మళ్ళీ మీకు I think maybe at next year only. August, September will be the peak of the pandemic for us. So there is no schools or colleges for August, September, even until October. We're expecting the wave to be falling after November only. If at all, if there are any chance of getting your class, it will be only after. Till then, you enjoy. Okay, then I'm leaving the class. Thanks for answering.
Sir.
Revanth, చదవాలి.
ఓకే సార్.
కొంచెం విను.
హలో సార్.
ఇప్పుడు చెప్పు. ఎంజాయ్ చేయండి. బాయ్. థ్యాంక్ యూ.
హలో సార్.
హలో, ఎవరు?
సార్ నేను జ్యోతి. ఎగ్జామ్ సిలబస్ ఇంకా చెప్పలేదు కదా సార్.
చెప్పలేదు. యాక్చువల్లీ 10th అన్నారు కానీ ఇంకా ప్యాటర్నే మాకు చెప్పలేదు. ఇంకా బిట్స్ ఎవరితే ఇచ్చేవాళ్ళం, మాకు ఇంకా వర్క్ చెప్పలే.
ఈ రోజు మోహంతి సార్ని అడిగితే నిన్నటి వరకు ఏం చెప్పారో అవి ఉంటాయని అన్నారంట సార్.
అంటే టాపిక్స్ అంటే ఇప్పుడు మీ క్లాసులు చెప్పిన టాపిక్స్ ఇస్తాం. సో ఒకవేళ ఎగ్జామ్ పెట్టినా సరే ఇండివిజువల్ గా మా అసిస్టెంట్ ప్రొఫెసర్లు అందరికీ మీరు చెప్పిన టాపిక్స్ నుంచి ఒక 4-5 క్వశ్చన్స్ ఇవ్వమని చెప్తారు. ఇట్ కుడ్ బి ఆబ్జెక్టివ్ ఆర్ థియరీ ఉండదు కదా మీకు. ఇంకా సార్ విల్ చూస్ సమ్ బిట్స్ ఫ్రమ్ అమంగ్ us.
కొంతమంది థియరీ అంటున్నారు సార్, అది కన్ఫర్మ్ కాదా సార్?
థియరీ ప్రాక్టికల్ ఎలా అవుతుంది? అవ్వదుగా. ఆ ప్యాటర్న్ మాకు చెప్పలేదు ఇంకా. వన్ థింగ్ ఇస్ ఫర్ ష్యూర్, మేము చెప్పిన టాపిక్స్ నుంచి మీకు క్వశ్చన్స్ ఉంటాయి. సో మేము ఏం టాపిక్స్ చెప్పాం అనేది ఎవరైనా వింటే వాళ్ళకి తెలుస్తుంది. వన్ కేసు అయినా మిస్ అయ్యామా ఈ లాక్డౌన్ పీరియడ్ లో అని చెప్తే అందుకని అడుగుతున్నాను, ఒకసారి చెక్ చేసుకోండి అని. ఓరల్ క్యావిటీ, ఫారింక్స్ రిలేటెడ్ టాపిక్స్ ఉంటే నన్ను అడగండి. అదవుతుందా? నోట్స్ రిలేటెడ్ టాపిక్స్ తెప్పిస్తారు. రత్నదేవ్ సార్ అది లెఫ్ట్ మాస్టమ్ తెలుసా? హలో ప్రకాష్.
హలో సార్.
ఫ్యాకల్టీలో రత్నదేవ్ సార్ మానేశారు మన దగ్గర అది లెఫ్ట్. సో సతీష్ సార్, myself, Sunil sir and Sandeep sir, we will be the assistants. Mohanty sir will be the professor.
చాలా టాపిక్స్ ఉన్నాయి కదా సార్. ఏంటి
ఏమున్నాయి?
ఆ రోజు మీకు పెట్టాను కదా సార్ ఒక ఫోటో, అంటే ఇంతవరకు ఏమైనాయి అవి?
ఏవి?
సార్ వచ్చేసా కదా సార్.
సిలబస్ అంటే కంప్లీట్ అయిపోవడం కాదు, మీది ఇంకా అకాడమిక్ ఇయర్ అయిపోలేదు కదా. మీకు నెక్స్ట్ 7th సెమిస్టర్ వెళ్తారు మీరు, అంతేనా?
3rd నుంచి 7th సెమ్.
చెక్ చేసి చూస్తాం. అవన్నీ టాపిక్స్ ఉంటే నాకు మెన్షన్ చేసే. యూ కెన్ టేక్ ది ఇంగ్రాజ్ ది క్రైటీరియా అనుకుంటే ఆ టాపిక్స్ నేను కవర్ చేస్తాను ఏమైనా సరే. ఓకేనా?
ఓకే సార్.
ఓకే దెన్ బాయ్.
థ్యాంక్ యూ సార్. బాయ్.
బాయ్ బాయ్.